Talk to people who have heart failure and who have devices in place. So this is not about patients with heart failure and how to plan their exercise regimen. So if you look at people with devices in heart failure, it could be patients having routine pacemakers, patients having ICDs in place, and patients having devices like cardiac resynchronization therapy. And most importantly, I'll conclude by a new era where patients with devices need a exercise prescription. So sometimes it may look very simple, we should just train like this gentleman when it comes to exercise therapy. So coming to pacemakers. So pacemakers, definitely, whether it is a single chamber or a dual chamber, whether there is a rate responsive mechanism in the device, and what are the algorithms which are present to detect VT as well as AF in these patients are very important. And it is relatively simple to give exercise prescription for these set of patients, simply because if you have a dual chamber rate responsive pacemaker, usually these people can carry out regular exercise activities like other non-pacemaker patients. So that is not a big issue. But even in that, if patient has a single chamber pacemaker and is having heart failure, then we need to restrict the exercise activity of these people, simply because sometimes they may have a syncope with exercise out of proportion to their routine activities. So it's always better to have a rate responsive mode, and usually people who have a dual chamber mode tend to have a better in exercise capacity, almost more than 2.1 minutes extra and almost 0.92 meds more they can have if they have a dual chamber rate responsive pacemaker. Moving on to ICDs, this is a systematic review of patients who have implantable cardiac devices, and if you look at the studies, there are close to 8 studies where they have looked at how exercise prescription in patients with ICD works. And it's not much to add, except for the fact that we need to keep the VT algorithms in such a manner that it doesn't detect even at rates say 120 like that. So that is something important. But it is very important that patients who receive CRT, they need a little more attention, simply because in CRT patients, proper exercise training is very, very important, because, and quality of life studies have shown that exercise training is very, very important in patients with CRT in their recovery from heart failure. So there have been 4 studies which have looked prospectively at patients with CRT and exercise training. I'll summarize them and come to the basic summary of that is patients with CRT do better on a 6-minute walk test if progressive exercise training is given in a proper cardiac rehabilitation program. Moving to the last part of my talk with respect to patients with LVADs. So I know LVAD is a new entity in a country like India, but in India as of now about 100 to 110 patients have received an LVAD. It's a very small number considering the population of 1.3 billion, but over a period of time these things will become important. So the important is that when patients have LVADs, how their heart performs depends on so many factors, including the status of the native heart, the type of the implant used, and whether patient has concomitant devices like ICDs in place. So this is the studies with LVAD patients and how the exercise parameters and outcomes were affected in these patients. I know it's a busy slide. But I'll like to focus a little on what happens with exercise in patients with LVAD. So this is about hemodynamic exercise responses in patients who receive a continuous flow LVADs like the HeartMate 3, which is now the most popular device being implanted. So I know this table is meant to confuse, but the idea is it's a very complex hemodynamics where you have on one hand a device, on the other hand you have the native heart, on the other hand you have the impact of exercise on the vascular hemodynamics in the individual. So there it can be lot of variations can be there with respect to peripheral vascular resistance, what drugs the patient is on, whether the patient is on beta blockers, whether the patient is receiving vasodilators for hypertension. All these things will determine their exercise capacity. So that is very important, and it looks not so simple. This is another example of how when the patient exercises, how the flow volume loops change. So for example, how the pressures change with respect to rest versus exercise. And there are 3 types of response seen with the HeartMate 3. So there is a variation in terms of cardiovascular output as well as stroke volume. If in LVAD patients, we don't use the word cardiac output, we use the word pump flow. When we look at pump flow and look at how these responses happen, it is little variable. So every patient needs a individualized prescription on what kind of exercises patient should be encouraged. So this is another example of how the LVAD and the exercise in the patient interacts. And this is another, this is, I think, more easier for us to understand. So this is how the pressure volume loop operates in a patient with heart failure with an LVAD. We all know the graph on the right side is a typical failing heart and its response to exercise. Now you move to the left and see how the LVAD patient operates. You look at the stroke volumes. The volumes are far less simply because the LV is far empty in these patients. And if you look at the impact when the HVAD operates at 2700 RPMs versus patient, and at the same RPM, if the patient exercises, how much cardiac output improves. Basically underlining the fact that patients with LVAD, when they are put on exercise, a lot of precautions needs to be taken, and that's the bottom line. That's why this is probably the most important piece of information that you should read up. This is from the European Society of Cardiology, which is a position statement on how to train patients with LVADs and how exercise training has to be provided. So it details in particular fashion how individual patient needs to be screened, individual nation needs to have proper risk stratification, proper warm-up, patients should avoid breath hold and Valsalva maneuver, avoid patients any trauma, and how comorbidities need to be monitored. Most importantly, after the exercise for 15 minutes, patient needs to be monitored. And this is just, it starts from, getting up from the bed itself. So sitting on the bed with the exercise, then transfer from bed to stretch. This is in patients who have received an LVAD. So it's like mobilization. So, and how gradually the patient comes back to how to promote low to moderate intensity exercise. Walk and talk approach is suggested. Limit, you should avoid knee lifts and resistance training. So we are not going to make a Mr. India out of an LVAD recipient. So we should avoid resistance training, avoid excessive muscle fatigue, and kind of a roving machine action should be avoided. At the same time, we should always look for contraindication. The important thing is symptomatic hypotension and heart rate more than 100. This is very important because if the patient is having VT, patient will still be conscious. So that is something very important. Patient having a VT, ongoing VT with an LVAD will be sitting apparently comfortable because the LVAD takes care of the cardiac output. So LVAD patient on a continuous VT will also be very stable. So these patients we need to be aware that if the resting heart rate is more than 100, desaturation is there at rest, and if any of the alarms of the LVAD is going persistently, these people should not undergo exercise at any point of time. And any patient who has gained weight, say 1.8 kg weight, that means some degree of heart failure is developing, these patients may not be suitable for further exercise training. So exercise training in an LVAD recipient is never easy. This is, I'll skip this thing. This is about how the patient is mobilized early, and this is how exercise training, how aerobic training, interval exercise training, strengthening exercise, and respiratory exercise training are provided over a period, and then combined exercise training is done. So this is a systemic flow chart that is to be followed in patients who have LVAD, and exercise training is planned. Thank you.